Please join me in welcoming Sam Flint.
Okay, good. You ready for some red meat? All right, I have a question for you. What is the easiest and surest way to kill a Tyrannosaurus Rex? Anybody know? No, you break the egg. You don't let it get started. And that's what we're here to do with these two health bears, these two healthcare bills. Because believe me, they are dinosaurs. They will take us back, not to 2009 before Obamacare and the ACA. They'll take us back a full generation. There's never been such a full frontal assault on the Medicaid program in its 52 years. When they said repeal Obamacare, were they talking about taking away the entitlement to Medicaid? I didn't think so. Now, what I want to know is what happened to the Republicans of just a few years ago. In 1997, the CHIP bill was passed, Child Health Insurance Program. And it was similar to the ACA in that it said every state had a choice to join it or not. It passed in 1997. Texas was the last state to adopt it. It did it in 1999, in only 2 years. Every state signed on to it, Republican, Democrat, or otherwise, okay? And the cost that it cost the state more money than it does for the ACA expansions, yet every state took it. Here we have a situation now, there are 19 states that are refusing Medicaid that's literally free for 3 years, and you only have to take it for 3 years. So and what are we doing it for? What's the goal? To give Warren Buffett a $600,000 tax cut that he says he doesn't want? 2.5% of the population, 1/40th of the population, is going to get a tax break averaging $50,000 a year. And for that, 22 million people will lose health insurance and more. That's just a headline number. Let's think about 22 million. What's 20? How do you wrap your head around it? 22 million people is the entire population of the following states: Nevada, New Mexico, Nebraska, West Virginia, Idaho, Hawaii, Maine, New Hampshire, Rhode Island, Montana, Delaware, South Dakota, North Dakota, Alaska, Vermont, Wyoming, plus the 956,000 people in the state of Pennsylvania who will lose their health insurance if either of these laws pass.
Yeah, not good.
It's morally bankrupt. Now, the bill loses on moral arguments, so let's just take a look at its efficacy. Let's just put aside, the compassion issue, which should never be put aside. There are 3 goals for health policy, okay? You want to have lowest cost, most access, and the highest quality. Quality, cost, and access. There is, the Obamacare bill was criticized for lack of cost containment. There is absolutely zero, bupkis, no cost containment at all in the Republican bills. And they repeal the cost containment that's in the Obamacare bill. Let me explain. They talk about consumer choice and getting more opportunities. You don't have to take a one-size-fits-all healthcare plan. Well, that's what they're going to do. The states are able to opt out of the essential benefits requirement. So what are essential benefits? Maternity care, emergency care, basic services, okay? You reduce those basic services and your premiums are going to go down. But of course, if you need it, who's going to pay for it, okay? So it's a cost shift. It's not cost containment. Obamacare had 3 big chunks of cost containment. First, it tried to improve quality. About 30% of the healthcare costs are unnecessary, redundant, and even harmful. If you improve quality of care, stop hospital infections, reduce hospital infections, reduce hospital readmissions, do the things that have a better outcome, you're going to bring costs down. Obamacare is filled with incentives in the financing system to make hospitals, doctors, and healthcare systems become higher quality and better, and therefore more efficient. Number 2, leveraging of preventive care and early detection of disease. Under Obamacare, everybody, no matter whether you get your care through the exchange or whether you're on Medicare, which didn't have preventive care until this, and it will be taken away, okay? Everybody, including employer insured, got first dollar coverage for preventive care, regardless of how high your deductible was. So the idea, once again, is to contain costs by making people healthier. And the third thing was regulation. We know how much the Republicans like regulation. There's something called the medical loss ratio. I won't get into the technicality of it, but what it is, it's a system that prevents health insurers from price gouging. They have to demonstrate that they spend 80 to 85% of every premium dollar on health care. Not on bonuses, not on marketing, not on other things. It has to be spent. That's gone. So when you look at the healthcare system, if you want to bring costs down, you have to improve the system. There is nothing in these Republican bills, yet they attack Obamacare for failing at cost containment. The exchanges. Why aren't insurers in the exchanges? They're leaving the health insurance exchanges because the Trump administration has ordered the IRS to not enforce the tax penalties for the individual mandate. Without the individual mandate, you have healthier people not opting in and only sicker people staying. That's a bad mix for the insurance companies, so they want out. But just in case they didn't want out, the Trump administration is doing something else. They're threatening to withhold all of the money that the insurance companies should get that cover low-income people's deductibles, cost share, co-payment. Now this was promised to them in the law. This was part of their budget. So what they're doing is they're sabotaging the health insurance exchange and saying, oh, the system's collapsing. We're going to ride in and say, only I can save it. Does that sound familiar? That's another thing too, Medicare Part D. Why aren't we negotiating? Why do the Republicans allow negotiation with drug companies? Everybody negotiates with drug companies. The VA negotiates with drug companies. France negotiates with drug companies. Canada does. That's why their drugs are so much cheaper, because they leverage that. But we don't want that in this country. We have to make sure that other interests are taken care of. If we don't get this bill, the state is going to lose $36 billion. The state of Pennsylvania is going to lose $36 billion in federal Medicaid, CHIP, and exchange subsidies. That money flows into the state. It's economic stimulus. It's jobs. It keeps the health system flowing. Nursing homes, 64% of nursing home beds or nursing home days are paid for by Medicaid. What's going to happen when that's capped? Okay, do you really? You may want to stay home and take care of grandma, but you got a job to go to. Who is this going to hurt? Who is this? How many people? In addition to that, again, the jobs: nurses, lab techs, food and laundry services. Many of those jobs won't be created or will be lost. And that means less sales tax, less income tax, and higher unemployment compensation. And finally, no matter how much money you have, you are still going to be hurt if this bill passes, because hospitals will not be able to maintain high-cost services, burn units, neonatal intensive care units. These are the kinds of services that, unless you have a patient mix where people are insured, no matter how much your cost shift, and of course all our private insurance premiums go up, because when Medicaid goes down and there's more uninsured, there's more cost shifting by providers. The point is, everybody in one way or another is in the same boat when it comes to the healthcare system. We have to defend the poor, we have to defend the middle class, we have to defend the structures that are working. The CBO has done 2 estimates since Obamacare was passed to look at the cost. Both of those estimates reduce the aggregate cost. I've got to stop now. I'm just so glad everybody is here.